This is the patient with a rise of CA19-9 and with a solid lesion of the pancreatic body with vascular invasion and pulmonary metastasis.
This lady has a locally advanced, more than locally advanced, has a metastatic cancer of the pancreas. This is the mass. I'm along the posterior wall of the stomach, and the mass is infiltrating the splenic artery and also the splenic vein going to the confluence. This is the confluence between the superior mesenteric vein and the splenic vein. You can't see the splenic vein here. And it's going down deeply to the superior mesenteric artery, which is this one, a little bit compressed by the tumor. So we really need to biopsy this tumor. You see, it's going from the body of the pancreas to the tail, going to the posterior wall of the stomach. This is the muscularis propria of the stomach, and probably it's coming also to the gastric wall. As you see here, with a very small amount of fluid, probably here, and so we are going to take a biopsy here. So the tip will come from this side. I just want to be sure that I don't have big vessels between the probe and the tumor, so I put the probe here. Okay. I go with the shelter of the needle. You will see the shelter here. You see this moving? Thank you. Remove a little bit the stylet and go in. Okay, I will use the elevator and I'm in. Okay, the tumor is very stiff. I can feel it with my hand, but I enter in a very good way because the needle has a very good cutting surface. So I will use the slow pull technique. I move the needle. We release the material on the smear and we see what we have. Okay, okay. See here, there's no blood,
viscous.
There's all this material, a little bit of mucus, because you see it's not fluid this, but it's mucus. Look this. So I will put the solid part into formalin, and I will prepare the smear for cytological evaluation, and you can also send for final evaluation to the pathologist. I just want to show you the slides of the biopsy that we took yesterday, because we had very good result, not for the patient but for the diagnosis. This is the first slide with staining with hematocillin and eosin, and you can see the material on the smear. This is what we smear. If you see here how we treated the material, this is just not the specimen that we put into formalin, but is this part. So we prepare 2 slides, and this is the result. On the second slide, you can appreciate a lot of cells. These pathological cells, they are malignant cells from adenocarcinoma. I hope you can see here. And even in a major enlargement, we can see on the third slides the cells. So you can see pathological adenocarcinomatous cells. So even if this is just a cytological specimen, it's very good for diagnosis. And we are waiting also for the histological specimen. Of course, it needs more time, and probably will be ready for today, but we have already the diagnosis on this material, so we are very happy on what we took from the biopsy.